So you've outlined or identified 10 things that I guess prevent dentists from kind of reaching their potential or closing more cases.
Right.
What are they?
Well, and I think before we jump into the 10, Randy, we should also talk about the big trends in dentistry that are forcing dentists to have to learn how to market and sell. We've had a really good ride in dentistry. Post-World War II, about a 25-year period where you opened a practice, and my father was part of this time in dentistry. You opened a practice, population's growing, middle-class income growing, everyone, the tides are rising, everyone did great.
Is that right? Everybody was doing well?
Everyone did great. Took us up to about 1970. Now we had a period of time, about another 20 years, where a lot of free money came into the profession, of course, via insurance, reimbursement schemes. So we had another sort of golden age where there was free money sloshing around the system. Once again, open your practice, don't have to do a whole lot to make success at that. Since 1990, the pool of money has been shrinking. And so we look at the ADA statistics, and the expansion in spending in dental services has been heading downward since 1990. And if you really look at inflation and those kinds of things, it's really sinking fast. And so suddenly you've got all the dentists going, why is this not so easy anymore? And that's really why it is. So we've got two golden ages that have passed, and now suddenly everyone's scrambling to learn how to market and sell. And especially the ones who have the most training, they really have to go into this, otherwise they just don't get the cases they want. So ultimately it really comes down to about 10 things that in most of these practices that aren't getting what they want, that those are at the root of.
Give me the biggest. Like, what's the biggest problem?
The biggest one is that none of this stuff sells itself. Implants don't sell themselves. Fast orthodontics doesn't sell. Nothing sells itself. You've got to go out and take it to the public, get their interest, and then you have to bring them back into practice and then sell it. And the biggest one is, the fact that especially once we go past a certain price, you really have to have certain skills to sell. So once we're beyond about $10,000 mark, which is
really the big case, as you call it.
The big case. And any more $10,000 case isn't that big. But yet once we're past that mark, in a given year, we know statistically that out of all the patients that will call the practice, only about 10% will buy it beyond that price point. So we have to have systems for dealing with that reality.
So you give them a sales system.
Right.
For the most part, would you say that they're just kind of winging it?
No, so it's
they're currently just winging it.
They're currently just winging it, and that's why the success is so miserable. They have no mechanism for what happens after the phone is answered to the point where the case is presented. And you have to have a sequence of events that are step by step in order to get there. It's too complex to wing it. There's a reason that pilots don't fly planes without checklist systems.
Okay.
Anything that's complex, you have to have a checklist step by step to make it work.
Were you a successful practice?
Absolutely. In fact, the strange thing about my practice is I had 3 operatories, which is tiny, right?
Okay.
Compared to most. I took that practice from about $300,000 a year to $1.2 million on 3 operatories as a general practice. And then once I got sort of the passion for niche dentistry, or implants in my case, took it to $1.5 million, still in 3 operatories, working 3 days a week.
Nice.
So I went from general practice to a whole niche style practice just by use of marketing and sales.
Okay, good. And you've written all this out.
Yeah, absolutely.
And you give the doctors these systems or protocols?
Exactly. So used to I would give a lecture on sales, and now it's actually a step-by-step system they follow in the office, which is, okay, at the initial visit, these are the things you do. At your diagnostic visit, these are the things you must do. When you're doing your presentations, etc.
Okay, what's another big one that interferes or gets in the way of their success?
One of the big ones also is, it's not in the dentist personality type to put themselves out to the public. You look on TV, and you have folks like Dr. Oz. You have the Doctor Show. Mm-hmm. All of these things that are putting medical procedures in front of the public, and yet as dentists, we don't do that. So for dentist personality types, they just don't like to put themselves out as being in front of the public. And so that's huge. Because as soon as you do, guess what? The public likes you. And because they like you, they want to know you, and then they trust you when they come into the office. And then if you happen to be good at your skills, it's a home run. But you've got to go out in the public. So that's a big one. They're uncomfortable with that. So the ones who can just make that little bit of a stretch and then put themselves out there, they do very well.
Do you have to redefine it for them? That means their perception of, I'm not a salesperson,
Exactly.
to where they feel good about it?
Yeah, because ultimately it's giving patients something they want and need without applying pressure or doing anything strange. But you've got to put it to the patient in ways that make sense to them. It's understandable. One of the things, I watch a lot of your programs, and you still even with a lot of
It's the only thing good on TV, by the way.
It's true. The doctors come on the show, you catch them, they're going into these technical terms, and the patients never understand that. So, one of the things we do with a lot of our clients, we will help them write a book for the practice, because again, books are build authority and credibility. And yet,
you did that for the dentist that I interviewed today.
Yeah. So
hugely successful guy.
Yeah.
And he has his own book.
He has his own book, because ultimately that.
So you put that together.
Yeah. So ultimately that helps him bring the message to the public. They understand it, and then they go, okay, well, this sounds like a good deal.
Because it was about teeth in a day.
Right.
And I said, you wrote the book on teeth in a day.
Right. Well, actually, I wrote
it. Right, but it's a great credibility builder.
Right. And it's
interesting.
Yeah, so it's credibility, and in this day and age, books actually have more authority over a lot of more disposable forms of communication. So that's just one more tool that we do as a side note for doctors we work with. Another way that there's a popular book a few years ago, a business book called Blue Ocean Strategy. Mm-hmm. And really what that was saying is that while most companies sit around and they sort of battle it out in their industry, fighting over the same things that everyone else does, which is a losing battle. You can never be too cheap if you're going on discount. You can never be, you sort of can never always outperform your competition if you stay in the same, sort of like the same lake, so to speak, or the same part of the ocean. And the whole concept is, well, let's work within our industry, but let's make what we do so different from what everyone else is doing that we're sort of in our own category. So there is no comparison. Mm-hmm. So this is when you have like the Southwest Airlines, you have the Apple computers, you have Starbucks. They created, there were plenty of coffee people, right? There was tons of coffee out there already. But what Starbucks did is said, well, let's just create another spot for the coffee and move into it. And so that's what we really do with these practices as well.
In my business, I run into dentists that in pursuit of trying to differentiate themselves, when I do my pre-production meetings, they sound like every other dentist.
Right.
So you help them
Right.
deliver their message in a different way?
Deliver it in a different way, because help them decide the technology, because all of this, obviously dentistry is very technology based, and you can combine these technologies in ways where now you've got a service that's unique. It might not be unique globally, so the same guy in DC could be doing the exact same thing in San Diego, but yet once we're in a local market, it can be unique. And so now they're operating sort of in their own blue ocean, as we call it. And also to get into that blue ocean, you've got to bundle and package your services in ways that other dentists start doing it. And then you got to take that to the public and communicate in ways they can understand it. So just like, earlier we were talking about this concept of perfect smiles in one day.
Yeah.
And that is taking, a technology that thousands of dentists have access to, but yet bundling it in a way and now putting it to the public in ways that they really care about. Because the public they don't want hassle, they don't want pain, they don't want time in the chair, they want it done efficiently and done well. And so those are the things we focus on with helping them take whatever niche it is they want to pursue and putting that in a category where they're really the only ones locally that do it that way.
Now you're doing kind of an immersion, I'm calling it an immersion, I don't know what you call it, where you get heavily involved in their practice.
Yeah,
their team, everybody.
Right, so we have, the way I've structured how we work, we have a lot of what I call, they're all vendors, but yet they're part of our team. So they help us do the pieces of the puzzle that need to be done. So just like if we decide in a market that being on the news, such as through Wellness Hour, they need to do that, then you're part of our team for that, Randy. In other situations, if it's web only, well, I have someone that's an expert at that, and they're part of my team. And then if it's phone training, we have people that take care of that. And of course, I'm sort of overseeing the whole thing. And then if we have a sales training where they really want in-depth training, I might actually do that with them personally. So it's not even just going online and doing our online trainings. And I find that for most practices that really want to perform well, you've got to have at least some of that immersion to make it work.
I think I like about you, even in our relationship together, and we have, this is our first time meeting today, is you're not paying me a commission to send me people.
No.
You're referring out of you think this works. And
Right.
I think that's great. And does that go with pretty much everybody you're doing?
Absolutely, because if I wouldn't do it, the way I look at this, the way I teach my clients as part of the sales training is even just when they present cases, say, look, I'm not going to give you any options as a dentist that I wouldn't do on my family members, My brother, my sister, my wife, my husband. Same thing goes with how we approach marketing and sales. I wouldn't give you any of these things or tell you to do it if I didn't do it myself. You know, it doesn't make sense. So there's a lot of that goes on where there's like commissions and all this stuff that influence. Doesn't make sense to me.